And joining us now in studio, Crystal Murphy. She's an Ontario Works caseworker with Toronto Employment and Social Services, and we welcome you here to TVO.
Thank you.
Let's just get a better sense, first of all, about what you do. You're, first of all, in Regent Park, right? A neighborhood in Toronto.
Yes, I am.
So what do you actually do with your days?
Well, I've been with social services for more than 9 years. So for the first 7 years, I was working in an Ontario Works office where I was issuing benefits for the Ontario Works program to clients for financial assistance, and then also supporting clients with their employment assistance.
You call them clients. Why do you call them clients?
Why do I call them clients? Each caseworker has a caseload, if you will. So they're a number of individuals and families that have applied for social assistance, and they've been assigned a caseworker, a coach, if you will, that will help them through the process, guide them, navigate them through
I'm not trying to be a jerk here. I'm just saying, usually when you use the term client, you know, you work for a client. In the private sector, you work for a client. Do you feel like you work for these people?
Absolutely. I'm there to support. I'm there to support clients and work for them. You know, the discussion earlier was about issuing funds and, you know, how much money, but really my role is more of a coach, and really what I should be doing most of my day is coaching people through the process of getting back to work.
Now that's your position on it. Do they see it that way as well?
I think that many people who are on social assistance, they may see me as somebody who's issuing money, their financial needs, the basic needs and shelter allowance. But when I meet with a client on a day-to-day basis, we have interview times that are pre-booked. And that's a chance for me to really gain their trust and talk to them about what their goals are, their short-term goals and their long-term goals. And almost always it comes up that they do want to return to work.
Because I want to understand that relationship better, because you know, there may be, the conventional wisdom may be, you're representing the government and you're the person I got to get through before I, you know, get my benefit check. But the way you've described it, you're sort of more of a life coach, helping them sort of get back on their feet. And I just wondered, you know, that sounds like a fairly dynamic relationship.
It can be a challenging dual role that we play, because I am tasked with issuing public funds. But my main goal is to support the clients in getting to where they want to go. So some people, that could be, you know, they may have an illness and they want to apply for the Ontario Disability Program, like as Laura mentioned earlier.
Right.
Some people want to return to work and maybe need some skills training to help them to get back into the labor force. Maybe they're a mature worker who needs training in computer skills. Maybe the person has a history of homelessness who needs somebody to help them through that issue, or some addictions issues that they need some assistance through. And so it's not just about issuing benefits checks, it's also about listening to the client, talking to them about what they want, and supporting them through that process.
Do you like your job, Crystal?
I love my job.
You love your job?
I do.
You deal with some of the most desperate people in our world. What do you love about your job?
I get to meet so many people and hear their stories, and everyone has a journey that they're on. And you know, when people say, "Oh, you're dealing with the most desperate people," those desperate people are talented, skilled workers who just happen to be out of work, or someone who is possibly dealing with a mental illness who needs some assistance in that sense. So in my role, I'm really I'm meeting people who just want supports to get to where they want to go next. So I don't see it as being depressing, or that I'm meeting desperate people. It's people that just are looking for some help, and I'm there to help them.
And again, the assumption is that the people that you're going to be dealing with, you're going to be dealing with for year after year after year. Is that in fact the case?
No, not necessarily, because if I can support them and help them to get the supports that they need set in place, there was discussions about childcare and housing and other supports that they need to in their journey, then they may not be on social assistance for very long. So if they're getting retrained, or if they're a newcomer who has an engineering degree from another country, and they just need a little bit of support to help them gain access to, the Professional Engineers Association, or they need some assistance with, language, then
you can help them get that.
absolutely.
So is it fair to say most of the clients that you deal with, you're dealing with, for what, 4, 5, 6 months, and then they're off to the races?
I'd like to say that, but the reality is that there are many people who are on social assistance for a long time.
For a long time.
Yes.
We've heard from somebody who, Laura, off the top of the program, who was a recipient, and we heard her frustrations with the system, but now I want to learn what yours are. From this angle of you being the coach, you could do your job so much better and help more people do better if, what?
I had less paperwork and more time to spend one-on-one with the client.
Give us a sense about that paperwork. What do you have to do?
Well, when you're meeting somebody who's applied for social assistance for the first time, there's a verification process where the person has applied on the telephone or online. In Toronto, we have an online system, which has streamlined the systems quite a bit. But when they come in, I have to walk them through their application and collect verification of income, assets, accommodation, look at their rental information, talk to them about their family size, and then after all that, hopefully get in a little talk about what their goals are. Write up notes in the computer database, get back to my desk, answer telephone calls where people might be in crisis, calling and needing some kind of benefit or some support, getting some faxes from service providers where they're saying my client was accepted into a computer training program or not accepted, getting mail from clients, getting reports from supervisors and managers to, for whatever reason that, we have to look at those reports.
Is there any way around all this, though?
It sometimes feels like there's no way out, and I would say that any caseworker would want me to tell you that it's a very stressful situation, that there's a lot of paperwork, and if we had more time to work with clients, we could see better outcomes. Is all that paperwork adding value to the process?
Sounds like no.
No.
No. But on the other hand, we need transparency, we need accountability, we need to make sure with those dollars going out that there's, no abuse going on. Can you do all that and do less paperwork at the same time?
This is where the dual role comes in. I mean, I am charged with issuing public funds, so I have to make sure that I'm being accountable and that there's integrity in the system. So it's a balancing act. And if there was any way that changes could be made to help me in my job, to assist the clients better, to kind of change the balance a bit, that would be much appreciated.
Tell me if you have a view on some of the things that we've talked about already. One of the ideas that the Commission has floated is that it isn't only social assistance recipients who should be eligible for this special added health coverage or vision care or dental care, that kind of thing. Maybe we should be giving that to low-income people as well who are not on social assistance, but I guess who you might call the working poor. You got a view on that idea?
I actually do. I was speaking to someone earlier about this topic where I had a client who was transitioning into the employment insurance system, so EI. And while she was on social assistance on the Ontario Works program, she was getting a drug card, and she was also getting benefits to attend physiotherapy. Once she transitioned into the EI program, there are no drug benefits
so she
included,
lost all that stuff.
And there were no benefits to go to physiotherapy. So in her case, she would have really benefited from having that benefit added to the EI program.
So in some respects, we have a perverse incentive built into this system. It makes more sense in some circumstances to stay on welfare than it is to get a job.
In some instances, yes.
So we got to figure that out.
Absolutely.
What about, we talked to Laura as well about one of the reasons she feels she has to use the healthcare system more is that she hasn't got enough money from her disability support rates to buy enough food, and so she gets sick a lot. you know, should we come up with some kind of voucher to help people go to a supermarket and, I don't know what, maybe it's a couple of $100 a month for them?
Honestly, it really broke my heart to hear Laura say that sometimes she only eats one meal a day. And I have to say that I do hear that from clients sometimes, that they are, especially in Toronto, it's very expensive to live. And the rental rates are so high that clients are taking money from, you know, a food allowance to use for their rent. If a food voucher would help, I mean, definitely some way of increasing the rates so that didn't have to happen. I mean, people should not be going hungry.
Mm-hmm. Okay, just between the two of us here. Do you know the system well enough whereby you can kind of skirt around the edges and find ways to make stuff work better for your clients, which might technically not be, you know, within the letter of the law, but that's the way it's got to be for things to work?
I mean, as a caseworker, there are so many benefits and so many legislations that you have to know. And when we talk about paperwork, another thing that does take up a lot of my time is really finding which benefits clients can be eligible for. So not necessarily skirting around any law or skirting around any legislation, but really going into that catalog of training to say, what can this client get? What can I do to make this client's experience easier? And imagine as a caseworker, you have 100 families that you're trying to do that for. So it can be really tough.
How many clients have you got?
When you have a caseload, it can be from 80 to 120 families, individuals and families.
And I guess you get to know them pretty well.
Yes, many of them you do. If you can gain that trust, it really is. Now that I'm working in Regent Park, I'm more concentrated on working in an employment center where I do have more time to spend one-on-one with clients. So I'm not carrying a caseload, if you will, anymore. I'm working within the community with community partners and engaging with employers. So it's changed the role quite a bit. And I do see how having less paperwork and more time with people really can bring amazing results.
Okay, so in our last few seconds here, if on a scale of 1 to 10, if 1 is the system is a disaster, it's hopeless, and 10 is everything works well, it's wonderful, and people stay on it for a little while and then go off into jobs, where are we right now?
My first instinct is to say a 6.
6 is not bad, but it also sounds like we got some ways to go.
Absolutely.
So that's about it, right? Gotcha. Crystal, it's awfully good of you to come into TVO tonight and help us with this. Thanks so much.
Thanks for having me.
Crystal Murphy, caseworker at the Toronto Employment and Social Services.
Support Ontario's public television. Donate at tvo.org.